I feel sick to my stomach. Rachel found it difficult to concentrate on her schoolwork when her stomach felt so uncomfortable and painful. Please help me understand what is wrong, Rachel asked her mother with a worried voice this morning. Her mother asked for every detail about what Rachel had eaten yesterday to identify the problem source. There was a big difference between Rachel's usual healthy appetite and today's complete lack of hunger. Her mother decided immediate action was necessary and called the family doctor for professional medical advice. Rachel's health had always been excellent, so this sudden stomach problem was very concerning for everyone. She could not eat anything without feeling nauseous, which worried her mother about proper nutrition and recovery. The first step was to remember exactly what Rachel had consumed during yesterday's school lunch period. It was true that Rachel had tried some unusual food at the school cafeteria yesterday afternoon. Her mother used the phone to call the school nurse and ask about other students with similar symptoms. Several students had reported feeling sick themselves after eating the same cafeteria meal yesterday at school. The doctor might need to draw blood samples to test for food poisoning or other digestive problems. Rachel's face looked white and pale, which indicated that she was definitely not feeling well at all. The expiration date on the cafeteria milk might have been overlooked by the kitchen staff yesterday. The school's food safety practice would be investigated if multiple students had become ill from cafeteria meals. Rachel had always been a model student with perfect attendance, so missing school felt very strange. Her mother decided to raise concerns about food safety with the school principal and administrative staff immediately. As a customer of the school lunch program, Rachel's family deserved safe and properly prepared food. Rachel lay on the front of the sofa, holding her stomach and hoping the pain would disappear. The school nurse called to explain that 5 other students had reported identical stomach problems today. Rachel's mother answered the door when the neighbor came to check in on Rachel's health and recovery. The fresh air outside might help Rachel feel better, but she was too weak to walk. The stomach pain seemed to be coming from behind her ribs, making her very uncomfortable. The economic impact of food poisoning could be serious for the school district's reputation and budget. The school site would be investigated by health officials to prevent future food safety incidents like this. The doctor's approach was to keep Rachel hydrated while her stomach recovered from the food poisoning. Rachel's teacher sent homework assignments home so she would not fall behind in her studies. Rachel felt like the room was spinning, as if she were on unstable land during an earthquake. The doctor in charge of emergency cases recommended rest and clear liquids for 24 hours. After 30 minutes of drinking small sips of water, Rachel began to feel slightly better. By 7 o'clock in the evening, Rachel's stomach pain had decreased significantly since that morning. At 12 noon, Rachel had been unable to eat anything, but now she felt hopeful. The doctor said recovery usually takes 4 to 5 days when food poisoning is not severe. Rachel had been 13 years old for only 2 months and had never experienced food poisoning. She watched a bee fly around the garden while resting by the window to distract herself. By evening, Rachel felt well enough to eat 1 small biscuit with some herbal tea. On the 21st day of the month, Rachel learned an important lesson about food safety. Her mother used scissors to cut open packets of oral rehydration salts recommended by the doctor. Rachel joked that she felt like a broken robot that needed repair, but was grateful to be recovering.